Hi, this is Kathleen Liberty. I am the Director of Public Health for the town of Franklin in Massachusetts. I will be going over the employee training for Phase 1 business reopening. These standards are minimum requirements only and are not exclusive or exhaustive. The training topics include hygiene protocols, social distancing, cleaning and disinfecting, recommendations, staff, and operations. This presentation will also cover key elements of prevention of COVID-19 found on CDC's How to Protect Yourself and Others page. So we'll learn how it spread, to wash your hands often, cover your mouth and nose with a cloth face cover when around others, cover coughs and sneezes, avoid close contact, clean and disinfect, monitor your health. The resources in this presentation align with the core strategies that are provided on the sector-specific checklists: social distancing, hygiene, staffing and operations, and cleaning and disinfecting. This presentation may be used to satisfy required training for employees on social distancing and hygiene protocols found in the mandatory safety standards for workplaces. Businesses are also required to comply with detailed sector-specific protocols, best practices, and checklists. Note that some sector-specific protocols and best practices are mandatory, while others are recommended. Currently, no vaccine to prevent coronavirus disease 2019, also known as COVID-19. The best way to prevent illness is to avoid being exposed to this virus. The virus is thought to spread mainly from person to person. Between people who are in close contact with one another within 6 feet for longer than 10 minutes, through respiratory droplets produced when an infected person coughs, sneezes, or talks. These droplets can land in the mouths or noses of people who are nearby or possibly be inhaled into the lungs. There is evidence that COVID-19 can be spread by people who are not showing symptoms, also known as asymptomatic. Important steps to keep you and others safe. Hygiene protocols, keeping you, your coworkers, and customers safe. Ensure that there are hand washing capabilities throughout the workplace. Wash your hands frequently and properly. Provide regular sanitation of high-touch areas, such as workstations, equipment, screens, doorknobs, restrooms, etc. Hand washing is one of the best ways to protect yourself and those around you from getting sick. Washing hands can keep you healthy and prevent the spread of germs. Germs can spread from other people or surfaces when you touch your eyes, nose, and mouth with unwashed hands. Prepare or eat food and drinks with unwashed hands. Touch a contaminated surface or objects. Blow your nose, cough, or sneeze into hands, and then touch other people's hands or common objects. Employees should wash their hands frequently with soap and water for at least 20 seconds. If soap and water are not available, use hand sanitizer that contains 60% alcohol. During the COVID-19 pandemic, you should also clean your hands after you have been in a public place and touched an item or surface that may frequently be touched by other people, such as door handles, tables, gas pumps, shopping carts, or electric cashier registers, screens, and etc. Before touching your eyes, nose, or mouth, because that is how germs enter our bodies. Follow these 5 steps every time you wash your hands. Wet your hands with clean running water, warm or cold. Turn off the tap and apply soap. Lather your hands by rubbing them together with soap. Lather the back of your hands, between your fingers, and under your nails. Scrub your hands for at least 20 seconds. Rinse your hands well under clean running water and dry your hands using a clean towel or air dry them. Hand washing stations should include a sign, hot and cold running water, soap, single-use paper towels, and a waste bin. Hand washing signs can be downloaded from the CDC website. Washing hands with soap and water is the best way to get rid of germs in most situations. If soap and water are not available, you can use an alcohol-based hand sanitizer that contains at least 60% alcohol. Sanitizers can quickly reduce the number of germs on hands in many situations, but do not get rid of all types of germs, are not as effective when hands are visibly dirty or greasy, might not remove harmful chemicals from hands like pesticides and heavy metals. The way to use hand sanitizer is to apply the gel product to the palm of one hand. Rub your hands together. Rub the gel all over the surfaces of your hands and fingers until your hands are dry. This should take around 20 seconds. Remember, hand washing with soap removes germs from hands. This helps prevent infections because people frequently touch their eyes, nose, and mouth without even realizing it. Germs can get into the body through the eyes, nose, and mouth and make us sick. So businesses should make sure that hand washing areas are easily located by visitors. Instructional hand washing signs should be located at all hand washing stations. Check the bathrooms to make sure that soap and paper towels are stocked at all times. Clean high-touch surfaces in hand washing areas at least once per day. Make hand sanitizer available at the facility entrance, service counters, common areas, and near shared equipment like elevator buttons or copiers. Encourage frequent hand washing and/or the use of hand sanitizer. Provide frequent breaks for hand washing. Remember to cover your mouth and nose with a tissue when you cough or sneeze. Throw used tissues in the trash. If you don't have a tissue, cough or sneeze into your elbow, not your hands. Remember to immediately wash your hands after blowing your nose, coughing, or sneezing. Next, we'll address social distancing. All persons, including employees, customers, and vendors, should remain at least 6 feet apart to the greatest extent possible, both inside and outside of the workplace. Establish protocols to ensure that employees can practice adequate social distancing. Provide signage for safe social distancing. Require face coverings or masks for all employees. Social distancing, also called physical distancing, means keeping space between yourself and other people outside of your home. To practice social or physical distancing, stay at least 6 feet apart from other people. Do not gather in groups and stay out of crowded places and avoid mass gatherings. All businesses must establish protocols to ensure that employees can practice adequate social distancing. Refer to sector-specific guidance for industry-specific requirements. Talk with your supervisor if you have any questions or concern about maintaining 6 feet separation in your workplace. Here are some examples of social distancing protocols. Take some time to review the table below. Physical barriers like sneeze guards are appropriate when 6 feet separation cannot be maintained. Add markings on floor to encourage social distancing in lines. Close communal spaces, such as break rooms, and if possible, stagger use and clean and disinfect in between uses. Work from home when possible. Replace in-person meetings with video or teleconference calls whenever possible. Consider rotating or staggering shifts to limit the number of employees in the workplace at the same time, and reconfigure workstations to allow the 6 foot separation. Close waiting areas, encourage visitors to text or call when upon arrival, restrict or limit non-essential visits, cancel all group events and meetings of more than 10 people. Post signage at the public entrance to inform employees and visitors of the following. Do not enter if you have COVID-19 symptoms. Face coverings are required. Maintain social distancing. Sneeze and cough into a cloth or tissue or elbow. And do not shake hands or engage in any unnecessary physical contact. Post signage at appropriate locations throughout the workplace, reminding employees and visitors to practice social distancing. And post a copy of the signed compliance attestation poster in an area within the business premises that is visible to workers and visitors. Not everyone who has COVID-19 is symptomatic. Wearing a face covering reduces the chance of transmitting the virus to another person and vice versa. Wearing a face covering is one of the several measures we can take to prevent the spread of the virus. The new mandatory safety standards for workplaces require face coverings or masks for all employees. See the sector-specific guidance for industry-specific requirements related to face coverings. Governor Baker issued a face covering order effective May 6th, requiring face masks or cloth face coverings in public places where social distancing is not possible. Face coverings must cover nose and mouth. They should fit securely and comfortably against the side of your face. They should allow for breathing without restriction. When putting on and taking off a mask, do not touch the front of it. You should only handle the ties or ear straps, and make sure you wash the cloth mask often. Wash your hands or use hand sanitizer after touching the mask. The use of a mask does not replace important social distancing or hygiene measures. All individuals must continue to maintain more than 6 feet of distance from other people. Wash hands often with soap and water for at least 20 seconds. And more importantly, stay home when you're sick. Cleaning and disinfecting. Establish and maintain cleaning protocols specific to the business. When an active employee is diagnosed with COVID-19, cleaning and disinfecting must be performed. Disinfection of all common surfaces must take place at intervals appropriate to said workplace. Please understand there are differences between cleaning and disinfecting and sanitizing. See the CDC guidance on cleaning and disinfecting your facility. Also, see sector-specific guidance. COVID-19 is a respiratory illness that primarily spreads through the air and through personal contact with surfaces and infected people. The virus that causes COVID-19 is enclosed in an envelope that is easily compromised by proper cleaning and sanitizing. It is unknown how long the virus can survive on surfaces, but it is recommended to clean and sanitize high contact surfaces at home, in school, and at work. Make sure to wear disposable gloves to clean and disinfect. Wash your hands immediately after taking off gloves. First, remove visible soil and dirt using soap and water, then disinfect. Use products that are approved by the EPA. If it has been more than 7 days since you last occupied an area, there is no need to disinfect, though cleaning is recommended. If an active employee is diagnosed with COVID-19, follow the CDC guidance on cleaning and disinfecting your facility. High-touch surfaces should be sanitized on a regular basis. High-touch surfaces include workstations, equipment, screens, doorknobs, restrooms, Identify high-touch surfaces in workplace and determine a frequency for disinfecting these surfaces. Also sanitize shared spaces, such as conference rooms and office spaces between use, and supply cleaning products. Keep cleaning logs that include date, time, and type of cleaning done. If there is a positive case, close down the area for deep cleaning according to the CDC guidelines. Provide training for employees regarding the social distancing and hygiene protocols. Employees who are displaying COVID-19-like symptoms do not report to work. Establish a plan for employees getting ill from COVID-19 at work and a return to work plan. The CDC defines those at high risk for severe illness from COVID-19 as people 65 years and older, people who live in a nursing home or long-term care facility, people of all ages with underlying medical conditions, people with chronic lung disease or moderate to severe asthma, people who have serious heart conditions, people with severe obesity, diabetes, chronic kidney disease, and liver disease. Symptoms of the COVID-19 include chills, repeated shaking with chills, muscle pain, headache, sore throat, new loss of taste or smell, fever, cough, shortness of breath, and difficulty breathing. Look for emergency warning signs for COVID-19. If someone is showing any of these signs, seek emergency medical care immediately. Emergency warning signs include trouble breathing, persistent pain or pressure in the chest, new confusion, inability to wake or stay awake, bluish lips or face. Call 911 if you have a medical emergency and notify the operator that you have or think you might have COVID-19. If possible, put on a cloth face covering before medical help arrives. Employees are encouraged and may be required to monitor for symptoms. This may include temperature checks before scheduled shifts. Stay home if you have a frequent cough, fever, difficulty breathing, chills, muscle pain, headache, sore throat, recent loss of taste or smell, or if you live with someone who has been diagnosed with COVID-19 and not yet cleared from isolation. Anyone displaying COVID-19 symptoms is encouraged to get tested. Contact your healthcare provider if you have COVID-19 symptoms. If you are experiencing COVID-19 symptoms, notify your supervisor immediately and stay home from work. Contact your healthcare provider to get tested. If you test positive for COVID-19, contact your supervisor as soon as possible. If you are positive for COVID-19 as a result of a possible workplace exposure, contact the local Board of Health as well. COVID-19 positive employees should not return to work until the criteria to discontinue home isolation are met, in consultation with healthcare providers and the local public health nurse. If you are unsure when it is safe to return to work, contact the local Board of Health for guidance. If a household member is positive for COVID-19 or you believe you were in close contact with someone who tested positive for COVID-19, contact your healthcare provider or a local Board of Health for guidance. You may be required to quarantine for 14 days. If you are required to quarantine, notify your supervisor as soon as possible and stay home. Coping with stress is so important right now, especially considering the added challenges that accompany a return to work. Take breaks from news and social media. Try to eat healthy, well-balanced meals. Exercise on a regular basis. Get plenty of sleep. Connect with others and try to do some other activities you enjoy. Do you feel unsafe at your workplace? Are the mandatory health and safety measures not being thoroughly implemented? First, speak to your supervisor or union representative to resolve the issue. If you would like to report a business or workplace that is non-compliant with the mandatory workplace safety standards, you may reach out to the local Board of Health. After contacting the local Board of Health, you may contact the Department of Labor Standards through their hotline or by sending an email to them. DLS will call or email you if an investigation is determined to be warranted within 72 hours.